Hey, Discovery listeners, I thought I would answer some patron emails. This first email is from anonymous middle-tier patron and YouTube member. She writes, I recently started couple therapy with my husband. Thank you for calling it couple therapy, by the way. I recently started couple therapy with my husband, and our therapist helped identify that my husband was emotionally abusing me. Okay. I'm trying to get better at setting boundaries and naming the abuse as it is happening, but I often feel worried that I'm being overly critical of him and calling something abuse when it is not. Can you help clarify what is and isn't considered emotional abuse? Some things, like criticism or blame shifting, are easier for me to spot, but many are more subtle. Here are some examples. Boundary violations. For example, tickling me while we're laying in bed after I've consistently asked him not to over the past several years. Chiming in here. Yeah, that's kind of a classic abusive sign in that you've asked him several times to not tickle you in this way. Now, I don't know, maybe if I were there, I would see that you actually want to be tickled, meaning that you're tickling him and he is just responding and you're just overreacting because you don't like it when it happens to you or something. But I'm going to take a guess to say that if you're in couple therapy and your therapist has identified that your husband is being emotionally abusive and that maybe even your husband agrees with this or at least is open to it, that this is in line with that. That so to understand these behaviors, I think it's helpful to understand where they come from. And I don't know about your husband, but commonly when someone is emotionally abusive in this way, it was modeled to them, one, so it's normalized. And they also are struggling on the inside with something, and their way of coping is to put you down or control you in some way. One way of thinking about this behavior, which I've worked with a lot of clients with this, where it's hands-on and it from the outside and even from the perpetrator can be claimed as affectionate or normal, but to the victim, it does not feel that way. It feels like a boundary violation. It feels like physical or even sexual abuse to some extent. There are examples in life, of course, when we kind of screw with each other, kind of mess with each other a little bit. Like if someone, like my wife, for example, she's never asking me to tickle her, but there are times when I do. And if I do it or she does it to me, and if we do it a little bit and it's definitely not welcomed, it's not being asked for, it's not requested. And there is a bit of, discomfort or like, oh my God, that's so tickly. And so where's the line between that and what you're describing, which in all likelihood is way beyond that point, right? And so to the perpetrator, they will justify it to themselves because it looks to them, or they're trying to justify it to themselves as just normal couples being fun together, But the recipient of it will not feel that way. And if they are sufficiently communicative about that, which they wouldn't have to say every time, but if every 10th time the victim were to say, hey, I don't like that, or can you stop, or the universal vibe back to the perpetrator is one of negativity, or at the very least not enjoying it, then there's something wrong with the perpetrator for them to continue to do it. It's such a mismatch, right? Because if you're trying to bond, and that's the thing to think about, is that for people who are abusive, they typically have massive amounts of relational traumas from either being abused and or abandoned and rejected, feeling like they're not worth it, feeling like they'll never find love or physical affection as a part of that. And so deep down, they're incredibly needy. They need human love, and in all likelihood, they're transferring their needs and hatred about their caregivers as a 2-year-old onto you. And so, like one of the things you will see in children is they will do this sometimes. Sometimes in a normal sense, sometimes in a pathological sense, in that they want, so think about a 7-year-old and you're watching TV or something, and he comes up to you as a parent and he tickles you, and you're like, ha ha ha, and you sort of, move him away from you, and he comes at you again. And you're like, okay, that's enough. And then he comes at you again, and he comes at you again. And he has a big smile on his face. Well, it's not hard to interpret that, right? He wants attention. He wants maybe physical attention. He wants physical love, maybe, right? Well, that's no different than if he's 45 years old. It's way more concerning and bothersome because he might be twice as big as you, but it likely comes from a similar place. And it was modeled to him, right? The physical boundary crossing was probably way beyond that. Like, his parents, one was beating the other, or they're beating each other or something. And so for him to tickle you, he interprets that as like not even close to the abuse that he saw growing up. So to be accused of that, this can't be possible. But deep down, there's a good chance that he really wants attention. He really wants you to love him as a partner, as a wife, but also as a mom. Because we all do this to some extent. We all want our spouses to love us like our parents did not. But when you need your spouse to do a lot of heavy lifting about this, then it becomes way more chronic and constant, and problematic. So there's a chance that what he's hoping for is that. There's another need, though, that might be being met, which is that of dominance and control, because they believe deep down that the only way to get love and attention is through dominance and control. So the trick is, typically in therapy with clients that will exhibit this, is I will say to the perpetrator, I will explore as best I can in therapy what they think they actually are trying to achieve by doing these things. And they might have a hard time with it. So I might start throwing out some possibilities. Like, are you looking for attention? Are you looking for love? Are you looking for physical attention? Are you angry about something and you're you're converting that anger into what feels playful from the outside, but is actually not playful on the inside? What's going on? And then if we work our way backwards, then there are much more functional ways of asking or communicating about these things. You know what I mean? So that's one thing. But anyway, yeah. So boundary violations. I mean, I don't know if I'd call it if you call it a boundary violation, that's fine. But I would just call it what it is physically doing things to me that I don't want you to do. I mean, it's not rape, but it's on the spectrum, And so if I'm saying don't do this to me, it's not fun. It's not funny. And stop it. Like, just don't ever do that again. Going on. Passive-aggressive comments, for example. Going back to the previous thing. Another way this will manifest that some of you might already be thinking about is when a partner will just randomly grab you sexually or touch you sexually when you are definitely not feeling it in the moment. And it feels controlling, it feels out of the blue, it feels objectifying, could be scary. And if the perpetrator isn't typically physically violent, then it can be hard to interpret it, right? Because you feel like, well, why do I feel this way? Am I just sensitive? This sort of thing. And, it's hard to pin down these things because there are possibilities of other sensitivities that are happening from the target, and both could be happening. The target could be overreacting, and the perpetrator could be perpetrating. So case by case. But if you are telling someone, please don't do that, and they continue to do it, something's wrong, and that's just not okay. So going on. Passive-aggressive comments, for example, well, I guess I'll call them then, in a sarcastic, bitter tone. Well, I guess I'll call them then. Passive-aggressive comments. Yeah, so you're asking, is this considered emotional abuse? Well, one of the things to possibly broaden is away from just emotional abuse, because that can feel limiting to some extent, because the physical boundary violation of tickling you, and you've consistently said, don't do that. That's not emotional. That's physical, or maybe even sexual, So I would just say abusive or harmful or hurtful or invasive or harming me seemingly without caring that it harms me. Because when thinking about it as abusive, I think we kind of are tempted to go to like an internet definition of what is abusive and or not. But at the core of abuse is harm and fear and intimidation and control and being slowly gaslit, and controlled and coerced and beaten down emotionally and physically. So just think about those fundamental things, like when a bully pushes a kid down the stairs, if we just say, oh, that's abusive. Well, okay. But you can also just say that was a human being pushing another person down the stairs, and that must have been really scary and hurtful to that kid who was pushed down. It hurt and it was scary. When he is tickling you and you've consistently said, stop it, that could be terrifying to think that he doesn't care about you not wanting, or he just uses you as a plaything without caring about how you feel. That hurts. It's scary as fuck, So when we talk, so you're asking, is it abusive or is it harmful? Is it a part of the abusive pattern for him to be passive aggressive, like saying, well, I guess I'll call them then? That one's harder to determine. Could be, but it's definitely not helpful. Sarcasm is almost never helpful. I never really thought about it until I started watching reality TV, that sarcasm is a very problematic thing to do when you're in conflict with your spouse. Like, oh, great, here we go again, and for sure John Gottman would talk about this sort of thing, the contempt aspect of the four horsemen of the apocalypse. But I don't think I realized, because I didn't see it very often in my office, because people tend to be minding their behavior a little bit more in terms of that kind of stuff. Not always, but typically. Whereas in the real world, I think people are sarcastic a lot with each other. And you can think about this for yourself. Are people being sarcastic with you, and are you being sarcastic with people? Now, that doesn't mean that one's feelings are wrong or bad. It just means it's not a functional way to communicate your needs, and it doesn't usually go over well, So that's just something to think about. Plus, I think if you're trying to seriously make a point, I think it demeans yourself to roll your eyes and go like, oh yeah, great. So here we, you and your, I think there are more precise, mature ways of communicating things. Anyway, so for him to be sarcastic is dysfunctional. Is it abusive? You just have to ask yourself, do you feel harmed and intimidated by it? If not, then, I don't know if you'd fit it into the abusive category. You just fit it into a category of him being fucking annoying or using bad communication. So, and maybe that's another metric, is just, do I feel harmed? Do I feel scared? Do I feel intimidated? Then that's a pretty good indication that this is a part of the abuse syndrome or cycle or set of behaviors going on. Playing the victim, for example, let's just acknowledge the fact that I just got a call and was villainized very quickly after I said I was confused by something he said and asked for clarification. Okay. So you, anonymous middle tier patron and YouTube member, told him that you were confused by something he said and you asked for clarification. Oh, I'm confused. What do you mean by that? And then he says, let's just acknowledge the fact that I just got a call and was villainized very quickly. Okay. I don't have the context for all this, but I could imagine what this involved. So playing the victim. I'm not a fan of that phrase because it's over applied or not precise enough. but and it doesn't get at the core of it. For me, I think what you're referring to in the phrase that I would use is that he isn't taking responsibility. He has a hard time accepting that he might have done something wrong, like communicated inefficiently or ineffectively, right? So that one's harder. It could be, but again, do you feel intimidated? Now, perpetrators of abuse will shirk responsibility because they need to in order to uphold the cycle and the press of intimidation and control. But also, often they don't even know that they're being abusive. They're not trying to be harmful. They're trying to be a good partner, and they think that they are being a good partner because they're better than their parents were. So anyway, going on, and everyone does this. Literally everyone. I do this all the time as well. If I'm accused of something, if I'm criticized, if I'm hot under the collar or I'm hurt, I will absolutely deny that I'm responsible. We all do this. That's not abusive. Going on. Getting into the weeds in an attempt to gaslight. Getting into the weeds in an attempt to, for example, changing topics or focusing on and debating small details. Changing topics or focusing on and debating small details. Then saying things like, "That's not exactly what I said," or "You're remembering that wrong." So I forget the topic at hand and become confused and exhausted. Okay. So this is hard, because this is all normal as well, but could be part of the gaslighting effort. I see, saying things like, that's not what I said, or "You're remembering that wrong." Yeah. Well, so again, everyone does this. I'm quite positive, anonymous middle-tier patron and YouTube member, you have done this as well. That later in a fight or the next day or the next month, you are referring back to a previous fight that the two of you had. Each of you has said, no, I didn't say that, even though you did say that. But you don't remember saying that. And you're quite positive that you didn't, or you don't want to believe that you said those things because those are bad things to have said. And the person making the accusation about what you said is also probably distorted. No one is often right in the situation. So that is not gaslighting. It can be gaslighting. If it's voluntary gaslighting, then they know that they said that thing, but they're denying it because they're trying to make you think that you're crazy. But more often, they actually don't remember saying that, or they're in such shame about having said that they have to believe they didn't say it, even themselves, to themselves. They have to believe that I didn't say that, even though they kind of know that they did. Can that result in gaslighting to the victim? Yeah, but it's not on purpose. You know what I'm saying? But like I said, everyone does this. And so now, can you do it and he do this in a fight? Like, I didn't say that when you did. And your version of doing it is not harmful and intimidating, but his is. Yes, it is possible. The way that he's saying things or the foundation of his communication might be intimidating, and it might not be on purpose, but if it's intimidating and it would intimidate a lot of people and it's not just you, then that's abusive. Doesn't that's the thing about abusive behavior, is that if it has the unconscious motivation of trying to establish control and domination, intimidation, and often trying to get you to stop thinking negative things about them so that they can be assured that you love them and won't leave them. They could be saying the nicest thing to you, and yet it could be intimidating and abusive. They could be like, "I love you more than anything, and I don't know what I would do without you." Okay, so verbatim, those are really nice things to say. But said in a certain way, under a certain context, can be terrifying to hear. And that's the thing about the internet discourse around what is abusive, right? Is a TikTok will say, this is abuse. And I'll hear that. I'll be like, maybe, or this is gaslighting. And I'm like, well, and sometimes they're on the ball, but it's more important to think about what the intent is, even if it's unconscious, and what the effect is. Now, one can be intimidated by non-abusive behavior because of our own issues. But anyway, going on. Criticizing me without offering specific or constructive feedback. For example, well, you have problems with communication too. And so it sounds like you're telling him you have problems with communication. Then he claps back with, well, you have problems with communication too. And when I ask for more details so I can change my behavior, he is unable to provide any, or refers to specific situations that only happened once several years ago and are not a part of a behavior pattern. Yeah, again, these are all in a category. So the only one I've heard thus far that is clearly abusive is tickling you when you've told him not to. These other ones, it could be, and I would talk to your therapist about this. Making accusatory comments, accusing me of gaslighting him after I say things like, that's not the way I remember it, or I feel differently. Yeah, that's all this. It's the same. It could be, but it's certainly not a slam dunk. Now, if you went on Reddit or TikTok and asked everyone if those things are abusive, I'm pretty sure you would get a unanimous answer of yes. Classic narcissists, because, TikTok doesn't know shit about shit. Anyway, let's see. Thank you for reading my email. Whether you're able to reply or not, I want you to know that your content has been a huge help for me in not just learning more about narcissism and abusive relationships, but keeping my brain occupied and entertained. Our 1-year-old daughter recently went into liver failure unexpectedly due to a virus and needed a liver transplant. Oh my God. 1-year-old daughter. Terrifying. Liver failure. Oh my God. Afterward, she was diagnosed with a rare disorder that requires ongoing treatments at the hospital, so I'm unable to work while I take care of her. It's been pretty stressful, and your podcast and YouTube channel have been like a soft and fluffy blanket for me at the end of a rough day. You always say your patrons are rad, but you are radder-er. A smiley face. End of email. Well, I don't think I'm radder-er, but I'll take the compliment. And well, hopefully this was also a soft, fluffy blanket. In conclusion, what I will say, anonymous middle tier patron and YouTube member, is that it sounds like you're being abused. Your therapist has identified it that way. On the massive plus side, you're in couple therapy. My goodness, what a wonderful thing that you are doing and your husband is doing. And if you keep going down the road, there is a pretty good chance that things will get better. Not always, but it can definitely happen. Don't listen to TikTok or the internet about this, because they will say, once a narcissist, always a narcissist, even though there's no indication of narcissism. Or once an abuser, always an abuser, which is absurd. I have treated abusive individuals who were charged with a felony crime or a misdemeanor crime of domestic violence and were sentenced to either a stint in prison and fines and also my treatment program. And over time, they clearly got better, and we would do follow-up with the victim over time, and they would be different. It wouldn't solve everything, and they weren't 100% different, but change can occur. Absolutely. So, what a wonderful, brave thing that you and your husband are doing, and what a wonderful opportunity for you to protect yourself, to continue to get love, and for your husband to have a more direct way of getting his needs met that don't involve intimidation, control, and invasion of other people. I just keep thinking about him tickling you when you keep saying no. He wants something and he needs something, and he deserves to ask for that thing in a different way. It could be sexual. It could be not. It could be he wants a cuddle. It could be he just wants you to smile at him. It could be that he wants you to acknowledge that he exists. All of you people with kids or hang around kids, you know this behavior when a kid just wants you to acknowledge they exist, because kids don't know they really exist unless us caregivers, us adults, actually acknowledge them. I mean, they literally don't know if they exist, and particularly if they've been through traumas. So when kids do that, they're not looking for anything specific. They just want you to look at them and interact with them as if they are taking up space, as if they matter. They matter enough that you are taking the time to look at them. And they will take even negative attention and anger from you as a caregiver, as opposed to no attention, right? Because they'd rather exist and be known and be hated than to not exist at all. And so your husband trying to tickle you to get attention might be an adult manifestation of that. It doesn't make it okay, and it doesn't mean you have to put up with that shit, but what a glorious opportunity for him in therapy to get at the root of that and begin to communicate about it in a more straight, direct, vulnerable way. What a wonderful thing. All right, let's take a break. All right, we're back from the break, and I just got done going downstairs and tucking in Stacy to bed, as we always do, because I'm a night owl and she's not. These people are an OPP sort of thing. They became middle tier patrons in about the middle of 2022, and I want to thank them by highlighting them for not only being patrons, but also being middle tier patrons, and also being patrons through thick and thin for the past 2.5 years. We have Paul from Vancouver, BC, Noreen from Dublin, Ireland, Sophie from Norway, Andrea from Cheyenne, Wyoming, Juliet from Chicago, Illinois, Trissa from Yakima, Washington, which is where my ancestors are from, my Japanese ancestors, Mary from Kingston, New York. We have Kayella from Bonnie Lake, Washington. I know that little town. Courtney from Alexandria, Virginia. Grant from San Francisco. Sarah from West Columbia, South Carolina. Terry from Sunnyvale, California. Candace from Houston, Texas. And then from God knows where, we have Chelsea, Ayanda, and Elizabeth. And then at the mug level of patron, we have, for God knows where, Gersian. And then we have someone who signed up in the middle of 2022 who is at the highest tier, and they identify themselves as none, as in none of these things. So I think that just means they want to be anonymous. Thank you for becoming a patron, all of you people. Thank you. Let's go to an email. All right, these next 3 or 4 emails have to do with career as a therapist, I believe. I lumped these together. We have patron Simone from Iowa. She says, I absolutely love your content, and much of it has been life-changing for me in a very positive direction. Oh, well, that's nice. I am considering becoming a therapist. Well, that's even really cool. That's even better, patron Simone from Iowa. I can do so at a major discount. I can become a therapist and go to graduate school at a major discount if I pursue a degree at my university where I currently teach. I need to choose between 2 programs in clinical mental health counseling. One program is through the psychology department, and the other is through social work. Any words of wisdom on which program to choose? They are both highly accredited and have positive reputations. Thank you. Yeah, well, it's hard for me to know because I don't know what you want to do in, specifically once you graduate. And also, just knowing that a university has a psychology department and a social work department doesn't tell me much. Those 2, particularly psychology departments, can be very varied in what they do. For example, at the University of Washington here in Seattle, their psychology department doesn't do any clinical training, at least the last I heard. And it had been that way for decades. They do research where they primarily research on like rats and mice and occasionally humans. I actually, when I was getting my bachelor degree, you could get extra credit in psychology class. I took one psychology course, Psycho 101, because I heard it was easy, and it was. And one way to boost your grade is by volunteering to be a participant in their various studies. And one study I was involved in had to do with, they fed you alcohol and then ran a bunch of tests on you, like your response time and your pain tolerance, and they would like electrocute me and stuff. And this study actually went on for a number of years, beyond the extra credit of that class. But anyway, so I don't know what your university psychology department program involves. Now, they might offer several degrees, one that's research-based, one that's clinical, or one that's clinical and one that isn't, and they don't have one that's... So there's that. Then also in social work, that can be pretty varied as well, in that, generally speaking, if this is all that I knew, I would say don't choose the social work program because, well, it's hard to know, because also with social work, it's a master's program in all likelihood, which is a lot less work, time, and money. And after you graduate, in all likelihood, you could become a therapist and practice as a therapist and become a good therapist. Whereas a psychology department, typically, you're going to have only doctorates in psychology, right? It's not typical to have a master's program just in psychology, but it depends. Typically, you're going to have masters in marriage and family therapy or masters in mental health counseling. Anyway, so I don't know the answer to the question. I would actually ask what they train people to do. Now, and I will say, though, that social work, and I've heard this from actual social workers who have actually been on this podcast before, that will say that they do not recommend, if you want to be a clinician as a therapist, they do not recommend getting a master's in social work, because masters in social work typically will train you to do a lot of things that don't have anything to do with therapy. And sometimes they will be geared towards people that are not thinking about being classic therapists, where clients come to you and that sort of thing. I don't know if this is still true, but a social worker that I know told me that it's common for social work programs to not require a class on ethics, which is bizarre because that's just typically not their history. The social work degree programs tended to train people to work in hospitals as part of a medical team. Not always, but in at least the West Coast, that was the case. So it really, sorry, I just banged. So I was scratching my back with a back scratcher because, when you get a scratch in the middle of your back, it's so hard. And sometimes I'll pull a muscle in my old age as I'm trying to scratch it. So I got a back scratcher, y'all. So yeah, I think I answered the question basically by saying, I don't know, and I would look more into it. And generally speaking, if people are wanting to become a therapist, I would recommend that people look at mental health counseling programs that train you to be a licensed mental health counselor or a licensed professional counselor, or you look at marriage and family therapy programs which train you to become a licensed marriage and family therapist. Those are the two, that's the bread and butter of the therapy clinical world. The vast majority of working clinicians have graduated from those programs and have those kind of licenses. The third option would be to become a psychologist and get a doctorate in psychology and be trained that way, but that is a lot more money and a lot more time and is exponentially more difficult. Not in terms of the schoolwork, but in just terms of how much time. because my doctorate is in psychology. I'm trained as a psychologist, and I'm also trained as a marriage and family therapist. And my marriage and family therapy degree required an internship that was a year long, and it was half-time work. My psychology doctorate, I had 5 internships, one of which was a full-time job, and I was extremely lucky to get one in Seattle. Most people have to move for their internships, and that's just their final internship. But there's like 3 or 4 other internships typically that are half-time jobs as well. And yeah, so if you're not going to do assessment or research necessarily right away, that is not the way. Anyway, going on, anonymous patron. Well, let's take a break first. All right, we're back from the break. Let's do another OPP because I always forget to do these. These people became patrons at the end of 2022, and they are at the middle tier patron and above level. We have annual middle tier patrons, Colleen from Victoria, BC, which I've been through to a couple times. It's one of those destination places that Seattle people go to. We have Wei from Elmhurst, Illinois. We have Erica from Las Vegas, Nevada, which I've also been to a few times, and Kate from Wheatland, California. Thank you for becoming a patron, and particularly an annual middle tier patron, and staying that way since the end of 2022. Okay, so anonymous patron, she writes in and says, I am currently pursuing a master's in counseling. I intend to work in the field. I also did this so I could work flexibly and save money to eventually pursue a PhD. Oh, just a side note on the previous emailer, you were saying that you get a significant discount if you go to one of those 2 programs in your university. And I get it. In a lot of ways, one of the main reasons why I decided to get because I had a master's, and my mentor and boss, Paul David, was asking me to get a doctorate so that I could be chair. I could become program director, and he could pass the duties over to me. He could give me his program because he only trusted me with the keys to the car, and he didn't want it to give to others. And I didn't have a doctorate, and he couldn't give it to me if I didn't have a doctorate. And because I'm the loyal person I am, I was like, okay, even though I vowed I'd never go back to school. And I decided to get a doctorate, and the smart move would have been to get a doctorate in marriage and family therapy, or even a doctorate in counseling, because those doctorates honor your master's, meaning that, a very rough way of looking at it is that a doctorate is 2 masters, is one way to think about it. And so when I was thinking about, where to get my doctorate, one of the options that was available at the time was to go to the psychology doctoral program at Antioch, which is where I worked, and I lived across the street. So I would, live across the street from both where I worked and went to school, So I got a 60% discount, which is a lot, and tuition is a lot of money. It's not uncommon for someone getting their doctorate to spend upwards of $250,000 on tuition and, staying afloat with their bills and books and other projects and stuff. So to save 60% was a huge consideration. And I chose to do that, even though it might not have been the best choice, because it was a lot more work, and it wasn't in the field that I was planning on. I was becoming a program director of a marriage and family therapy program, but I'm being trained as a psychologist, which is a different profession in a lot of ways. And so I understand that that desire. Plus, if you already work at the university, it's just so much easier to walk across the hall and go to class, right? So maybe you make some sacrifices, and if you want to become a clinician, getting a master's in social work, even though there might be some insufficiencies or some a lesser focus on clinical work, as like a private practice therapist, you can always make up for that by getting additional training, supervision, maybe even taking electives in ethics and post-grad work. and maybe that's the best decision for you. Anyway, so getting back to this new person, anonymous patron, I'm pursuing a master's in counseling. I intend to work in the field. I also did this so I could work flexibly and save money to eventually pursue a PhD. In speaking with a peer, they asked, why are you studying counseling if you want to get into psychology? I have spoken with those in the field who are doing work that I'm interested in. Opinions have ranged from, you're going to have to work really hard to get yourself out of that and set yourself apart, to get yourself out of that. Or if you are interested in something, go for it. I love for you to weigh in this. Thanks. Okay. Well, again, there's a lot of unknowns to me, but when you hear from people, you're going to have to work really hard to set yourself apart. It depends on what you plan on doing. It depends on where you live. But generally speaking, in the United States, if you do the standard training, like a master's in counseling, and you market yourself, to some extent, okay, you're average at marketing yourself on the internet, then over the first 5 years of building your private practice, it will be thriving, and you'll be earning upwards of $150,000 to $250,000 a year gross, before taxes. And when you own a business, when you're self-employed, you get taxed more. So there's that. Now, do I know people who worked hard and failed in private practice, meaning that they had fairly low client loads? Yeah, I saw that. I supervised many people post-grad and saw the whole bell curve. There were people that had a full practice within 3 months because they were that good at marketing and were that professional and that good at retaining clients. And I had other therapists that after 5 years, they had 2 clients total. And you just don't know who you're going to be. But if you're level-headed and you're humble and you seek good information and you're not afraid to sell yourself on Facebook forums and that sort of thing, elevator speech, that kind of stuff, doesn't have to be perfect, but you have to put effort into it, then, generally speaking, things go well. And that's just private practice, right? Getting a job at an agency is not that hard because there's a fair amount of turnover in those positions. But yeah, and also, the idea of having to set yourself apart. I have seen this, and I've talked about this before. I will hear this all the time. People will say, like, if you want to go into private practice as a clinician, as a therapist, you have to have a niche. You have to set yourself apart. Otherwise, you will fail. I have not experienced that. I have never done that as a clinician. And some of you might be thinking, well, you're the great Kirk Honda. Well, I was not. I am not, and I was not. When I started my private practice, I was 26 years old and barely knew anything about anything, and was insecure and had a massive imposter syndrome, and actually wasn't very good as a therapist yet. And yet, I plugged away, and I didn't even have the internet, and you just, if you want it badly enough, you just keep your eye on the ball, and maybe once a week or every other week, you spend 15 to 60 minutes thinking about marketing and where your business is. You just give it some thought and don't avoid it. Don't expect someone to come along and fix it for you. It's yours to make. Then, things tend to work out. So there's that. So in terms of finding a niche, that can help, but it can also hinder, because say your friend in graduate school wants to send you a client, but they find out that your niche is a different niche, then they won't send the client to you. So, there's a lot of different thoughts on this. The other thing is I would be known to have a niche and a specialty among certain people, and other people would think I had a different specialty, and they would, like I had a social worker who worked for the state, for the government, who thought of me as specializing in Korean boy adoptees into white families. That was not something I set out to be a specialist in, and it was never something I wanted to be known for, but he thought of me that way, and he sent me a lot of clients along those lines. Across town, there was a former client of mine, a mother, a family, and this mother saw me as a very effective family therapist. And she would send me a lot of families who had teenagers who were struggling. And then I had another group of people that saw me as the borderline specialist, So you can use that to your advantage, right? If they tend to get a lot of people like that, like if you talked to a center that specialized in autism and they knew you as a specialist in autism, then they're going to send you those autistic clients. But you might actually only have 5% of your clients that are on the spectrum. And 95% of your other clients are couples, so there's a lot of, the thing about being in private practice is it's the same as any other business. You're like a hair salon or a restaurant, except the difference is you have no client base. No one knows you and no one cares about you. You don't have any Yelp reviews yet. And so you have to build it from scratch, and you have to think of it that way. How do you sell yourself? How do you, and not set yourself, and there are multiple ways of setting yourself apart. You can set yourself apart by having a niche, but you can also set yourself apart by just being super charismatic and having a great headshot and having a good website and having a good elevator speech and holding yourself with professionalism and dressing in professional clothes, if that's how you want to, set yourself apart. Or you set yourself apart by being the classic stereotype of a therapist, where you wear a lot of purple shawls and have glasses and have comfortable shoes. Like what vibe do you want to give off to? There's a lot of different. You're marketing yourself. So anyway, but then you say that after you get your master's and start working in the field, you want to eventually get your PhD. What I would ask you is, why do you want to get your PhD? Because it's a pain in the ass to get your PhD. If there's a purpose, meaning that it will further your career, then yeah, meaning that it'll give you additional knowledge and expertise and qualifications to do something. Typically it'll be research or supervision or even teaching. Then yeah. But I find a lot of young people today, and it's almost just like overnight, it seems just like almost a universal thing among young people, that they all are just like, well, of course I'm going to get a PhD. I think it's just people just think of themselves as PhD people, even though when I ask them, okay, well, you want to be a therapist, so that's why you're getting a master's. Why do you want to get your doctorate? And they'll just be like, well, I just want to, what do they say? They're this, I don't know, I just figure, isn't that what you're supposed to do? Or I just want to learn more about, I want to be the best therapist that I can be. And what I'll tell them is doctorates in, especially the doctorates that you get after you get a master's in counseling, they have nothing to do with being a therapist. They're a completely different set of skills: supervision, teaching, research, assessment, this kind of stuff. And those are all, interesting, worthy things to pursue. But if those aren't career paths that you want to take, then why bother? Now, if you're the sort of person that just is like, look, I just love school and I love spending tens of thousands of dollars on it and writing papers and reading assignments, like I love that shit, then yeah, go for it, but just know that it's not helping you at all. Anyway, having said that, I didn't need to get my doctorate, which by the way was a whole other master's and a doctorate, you know what I mean? And it did benefit me for sure. It made me a better podcaster and teacher and clinician. So I'm not saying that it didn't, but anyway. Next email, Patron Alexander from Chicago, they say, I've been following your content for a few years and recently became a patron to access deep dives as supplementary material to my coursework. Since entering the program, my life has gotten a lot more complex and emotionally intense. I have a lot of unresolved business with my family of origin, and exploring how my early life is impacting my development has been overwhelming and heartbreaking. Okay, so just chiming in here. Yeah, it sounds like you're coming face to face with those unresolved issues in your family of origin, and you're using the classic language of a family therapist, or maybe you're just using the language that I use on the podcast, unfinished business and family of origin stuff. Anyway, so yeah, becoming a therapist typically in your typical master's program anyway will be designed either indirectly or directly to have you face these issues, because you need to face these issues. You need to wrestle with them. You need to know them. You might need to go slow. You might need to spread it out over the next 5 years, but you need to do it. You can't avoid it, and you have to recognize it. You can't be in denial of it. It will get in the way. At the very least, it will ruin your experience as a therapist. It will ruin your job satisfaction, and very possibly could harm clients. But going on, I realized that the past 2 years have felt like an intense blur of time and space due to living in the space between intense triggers. Well, just chiming in here, if you're actually having PTSD or severe trauma reactivity being triggered, then I would talk with your advisor about allowing yourself to slow down. I would do this because, I would have typically in my family of origin class, which is the very first term of the program for students. So there's a lot of people that have unknown amount. They might not even know themselves if they have trauma reactivity, because their therapy has never gone into it, or they have very little therapy or something. And so I don't know if these people were, whereas if I have a student who is in their third year of the program, I can rest assured that if everything went according to plan, they've already faced these issues sufficiently. And if they're still with us in the program, then they are probably okay with at least summarizing or dipping into it occasionally, maybe not talking about the traumas in their life in detail, but they're able to summarize them and highlight them, Whereas people in their first term, I have no idea. And I have to take that into account. And so as I'm teaching family of origin, I am asking them to face their childhoods, which might involve them facing their traumas. Might not, but might. And so I will give them a long talk about, all the considerations, and that I don't have the time and I don't have the role to suss this out. Now, you can certainly set up a one-on-one meeting with me and we can talk about it a bit, but I'm not your therapist. I'm here to listen and I'm here to help, but I don't have the capacity to do a full trauma assessment on you. And so when in doubt, as you're writing your paper, if there is a topic area of your history that feels like it might open a can of worms, that it will be overwhelming to you, then I encourage you not to write about it. Even though I am asking you to tell me about your childhood traumas, feel free to just not mention or mention it in your paper and say, there's a whole story here about some traumas that I've been through, but I know right now that I would be overwhelmed if I went into it. So I'm choosing not to do it. But I'm going to eventually do it. And I'm talking with my therapist or whatever. So for you, Alexander, in Chicago, I would make sure that your program isn't pushing you to go too fast, or you're not going too fast, So going on with your email, I had an emotionally immature and distant parent. I had an emotionally immature and distant parent, and was also born very premature, which I'm recognizing led to the most destructive patterns in my life. It is still hard to accept, despite clear evidence of the impact. I'm working on my coping mechanisms and self-awareness, but balancing my personal growth and my responsibilities has felt so difficult. Just chiming in here. So from the first bit, yeah, you're saying that you had a parent, a caregiver who was emotionally immature and distant. So I'm guessing someone that just wasn't there, and when they were not very helpful or containing of you or safe to be with, and that was very hard. And that makes sense given the rest of what you're saying. But then you say you were born very premature, and that often has an effect on things, but it's not guaranteed, right? So the rest of what you're writing kind of indicates that that's an obvious. And the reason why I say this is because people who are born premature can be stigmatized and labeled unfairly, and so I'm just hoping that that's not happening. Now, you might be able to say, no, because I was premature, this happened and this happened. Anyway, going on. I often return to episodes with you and Bob as a way to return to hope for myself and my ability to use my experiences to help other people. That's very nice, Alexander. Going on. How would you support a student who is having trouble reckoning with their raw materials? Thanks for being so open to strangers on the internet and providing the information and modeling that you do. End of email. I kind of feel like I already answered that question. I prematurely answered that question. How would I support a student? Yeah, I think I would just do what I said earlier. I would just say, here's the long-term picture. You know, if we sort of graph it out, there's these traumas and these issues that need to be worked on at this minimum level of pace. And that minimum level of pace might be over the span of 10 years, maybe 20 years, maybe 30 years. Or maybe we could only expect to get 50% of the way there by the time you retire. So let's plan that out, because that's realistic in terms of pacing yourself. And therefore, in this class, in this current class, or in this first year of graduate school, what can we realistically expect from you? And what could you realistically expect of yourself? That's what I'd be doing. And I might have to work with the teachers and say, look, Alexander has a much bigger issue here than the typical student. And so although you know that he has this set of issues, he's not going to be writing about half of them in this current paper, because it would overwhelm him, and it would trigger him, and it would cause him to be harmed, and he would either be harmed, or he would leave the program, or he would go into denial and put his head in the sand, or so we need to go at a workable pace for him. That's what I would do. Okay, one more email along these lines. An annual middle tier patron, Jocelyn G. She says, "Hello, Dr. Kirk. Of the topics you've covered, what has most illuminated my mind is you touching on postmodern theories in psychology. Do postmodern theories have any sort of foothold outside of academia? Other than the example of postmodern systems therapist who believes that they are always implicated in the family system, could you discuss other examples of postmodern thinking in clinical practice?" End of email. Good old Jocelyn G. This is a huge question, and a very good one, and a well-informed one. I don't know how I'm going to answer it concisely, but I'll do my best. So you asked, do postmodern theories have any sort of foothold outside of academia? Outside of academia. Well, it depends on what we mean by academia. But yeah, I mean, certainly there are a lot of those not in academia, like individual authors who study this sort of thing, armchair philosophers, this sort of thing, will know various different philosophical schools of thought, postmodern being one. But also, I've never been a fan of the label of postmodern therapies, because when you actually study postmodernism, you understand how broad and how comprehensive and honestly how confusing it can be. I mean, just studying all these, how do you want to get into it? I mean, you could talk about Heidegger and hermeneutics and all these just mind-blowing things that I would learn a lot from Phil Cushman, my mentor, who died a couple years ago. Anyway, So, do they exist outside of academia? Yeah, but not much going on. Although I will say that the idea of cultural relativism has definitely taken a foothold in popular culture. Advocates and people pushing for social justice, not so much anymore, but still to some extent, cultural relativism is a part of the postmodern movement, but going on. Other than the example of postmodern therapists, DDD, could you discuss other examples of postmodern thinking in clinical practice? I see. So, Jocelyn, you are saying that you know about the postmodern systems idea of understanding that we are not objective observers of the family. We are part of the system, and therefore our own impulses and experiences are embedded within a system, and we can't expect ourselves to be objective or unbiased, and we have to wonder how we're being affected and how we're personally, as a clinician, constructing things. So that's an important tenet often to what is called postmodern therapies. And by the way, the typical theories and therapies that are identified as quote unquote postmodern are narrative therapy, solution focused, and collaborative therapies, these kind of things. Sometimes people will say that motivational interviewing is postmodern or similar to social focus, and I would contend that it's not at all. In fact, it's like the antithesis in a lot of ways, because although motivational interviewing can in practice be very much like solution focused, at its core, and I'm pretty sure this is explicit, that motivational interviewing has a goal in that it emerged out of chemical dependency treatment, in that you had a chemical dependency professional who was talking with a client about recognizing that they have a problem and that they need to abstain. And the goal was set by the clinician, not by the client, which is inherently not collaborative, right? And so the method, though, is to ask questions that motivate the individual to progress through the stages of change until they recognize that they have a problem and are ready to take an action, right? But you're doing so in I guess in one way you could say manipulative way, or in another way you would say in a more helpful way, in a way that helps them to lead themselves, there's very certain way. But with solution focus, although it might have aspects of it, they would be extremely upset if one of their own, if there's another solution focused therapist that claimed they knew what was best for the client, even for a therapist to think that they thought it was best for a client to recognize that they have a problem and abstain. I mean, true postmodern therapists and true solution-focused therapists would never assume even that, Anyway, but to say, other examples of postmodern thinking, I guess I just kind of did, right? That's a central tenet, is that you do not know as a therapist what is best for the client, and you have to work from the client's point of view. And if the client doesn't want something, doesn't strive for something, then not only should you not be pushing for another thing, like you have a client that from your perspective, you would normally think this person has a problem with alcohol and they need to stop drinking. The postmodern therapist would, one, not engage in behaviors that would motivate from that unless the client agreed with that and stated it, without being prompted, by the way. But also, the solution-focused therapist would strive to eradicate that thought from their head, because that is contrary to the philosophy that clients know what's best for them, and that if you set up the questions in such a way, they will find their own solutions, and you have no idea what those solutions are going to be, but you do know the questions that will help people to get to their solutions. Like a common scenario would be that, well, let's just use like an individual client that is struggling in her marriage. And she comes to me, and I'm operating from this place, and I will at times, all the time. I try to use solution focus and narrative postmodern ideas and methods. I frequently will use them in therapy, and I would teach them to my students, hoping that they would comprehend it, because it is a huge paradigm shift. I'll tell you, I was taught all of these therapies and thought I understood them for about 20 years until I came across another mentor of mine, Bill Heusler at Antioch University, and he taught me postmodern and collaborative therapies in a way that I got it for the very first time. So studying narrative therapy or solution focus or collaborative therapies is in all likelihood not going to result in you understanding what they are, because it's such a departure from not only just the way humans think, but also the way therapists think. It's a whole, and it's very liberating. And when you see it in action and you feel it, it's really quite something. So I'm going to try to demonstrate it here. So a client comes to me and she's like, "Oh my God, I'm fighting with my husband and I don't know what to do. And I feel like there's a problem with him and he doesn't listen to me and I don't know if I love him anymore." Okay. So if I were to operate of myself that is not within the collaborative postmodern, angle, I would have my head, and I will do this, I will have my head in a space of, okay, I want to figure out, first off, I'd be thinking from her language, it sounds like she actually wants to improve things, or at least find out if they are salvageable. And if not, then she wants to leave, right? I might also be thinking, I hope she's not being harmed, and maybe I should inquire about that. So I would be thinking about that, and then I would be trying to figure out a conceptualization. I would be figuring out, okay, if we're going to improve this relationship, if that's what she wants, which I would ask, let's say I ask and she says, "Yeah, I would love it if the marriage," and it's like, "Do you want me to help you with the marriage improving?" Even though it's just me and you talking, she'd be, "Yeah, if there's anything that I could do that you think I can do, then I would love to talk about that." So, okay. So then I would set off to conceptualize what the problem is. And I'd be assessing attachment style and communication style and how they are aware of their hurt and fear in their attachment threats. I would be thinking about their distortions. I would be thinking about their childhoods and their relational traumas and the 4 horsemen of the apocalypse and all that kind of stuff. And then I would maybe tell them what's in my head, which kind of sounds like your husband is avoidant and you're preoccupied. Here's why. Here's the definition. Here's how it plays out. Here's why you developed this way. And here's, how these things can be improved. And here are some tips, Okay. So all of that is on a foundation that I have specialized knowledge that the client doesn't have. And the client doesn't have a pathway to figuring out, 1, what the problem is, and 2, how to get out of it. And that is a viable way of providing therapy. Now, the postmodern people would laugh in my face and say that I'm an arrogant bastard for thinking all those things. They would, seriously. I mean, they wouldn't laugh in my face, but they'd be internally laughing in my face, because the purists in the postmodern collaborative world are very adamant that clinicians, understand that they do not have the answers. They don't know shit about shit. There's no evidence that they know shit about shit, and they need to calm the fuck down. And I get that. I hear you, and I understand it, and I'm okay with it, and yet I don't ascribe entirely to it. But I do find that having a good amount of that paradigm in my core helps. It's similar to having both the paradigms of systems thinking and the paradigm of linear thinking in my mind. Sometimes linear causality is a coherent and helpful way of conceptualizing clients. Sometimes systems theory and mutual causality and circular causality is a better way of conceptualizing and motivating what to do in therapy. It's not either or, it's both, and knowing when to use when and how to mix them, to some extent, which I've argued about this with other clinicians, and they'll tell me I'm stupid. There's no way you can integrate these things. And I'm like, I don't know. I feel like I am. I mean, I don't think I'm special. I just think I'm not limiting myself to the dogma that these things are incompatible. And if you believe one, you have to refute the other. Anyway, so having a good amount of postmodern philosophy in my mind that, I don't know. And a way of helping people might not actually involve me prescribing things and telling a client what my conceptualization of them is. Maybe a client will come to something that is completely outside what I would think of, and maybe the client already is doing the solution, which is a philosophy of solution-focused therapy. That's why they call it solution-focused, because you're focusing on their solutions that they're basically already doing. And by asking questions like, okay, so you and your husband have been fighting a lot. All right. Well, what do you want to change? She says, well, I don't want to fight as much. I want to have good times. Okay. Then I would ask, well, when was the last time that you did have a good moment, even if it was not like it was before, but it was better than normal? In the past 6 months, what can you tell me? And let's say she says, well, there was this one day last week where I didn't hate him. And I felt like I saw the old him for a second or two. And I'd say, okay, tell me about it. So she tells me about it. And I say, okay, what did you do to influence that? And maybe she would say, I didn't do anything. It was him. He was just in a better mood. And I would say, okay, and maybe it was out of your hands, but what did you do prior and during that resulted in you telling me today and framing it in that moment as a step in the right direction? It's possible that she would eventually say something like, well, I was open to seeing something different. Oh, okay. And then I would say, so it sounds like what you're saying is something that you have control over, because you don't have control over him, but you do have control over you, that in that moment you chose to have hope and to highlight his humanity or his good side. Because in the moment you could have chosen not to recognize that he was different that day. You could have said, I'm seeing a hallucination, or you could have just ignored it. You chose to see it that way because life was giving you an opportunity for that, and you chose to feel good about it. You could have chose differently. You could have rejected it. You could have thought of it as a manipulation or something. You did something there. Now, that's not me as a clinician identifying the solution of the client. The client is telling me what was the solution, and I'm just highlighting it as the solution and inspiring the client. And I will not say, hey, look at that. You did something that worked. I think you should do that again, which is a very common thing that therapists will say, which is not a bad thing to say. But a postmodern person would never say that, because that's prescribing. Just because a series of questions have illuminated a solution that the client has already engaged in does not mean that I now have permission to tell a client what to do. The client will, one, naturally understand that. Because the other thing here is, the other premise in postmodern therapies is that when we play along with the paradigm that clients are helpless and we know everything, then clients have a tendency to have a locus of control outside of themselves, and they tend to wait to be told what to do, because that's what we're doing. But if you set up an environment that is otherwise, then clients feel like, oh shit, I'm in the driver's seat. I need to take responsibility for this. I need to do something. And or I am powerful. My therapy, I leave the therapy office feeling not like my therapist is good, but I'm good. I leave the therapy office feeling like I already know the answers and I'm already doing the things. I just need to do more of those things. That's all I'm getting out of this, And that's that can be a very empowering position. And it also can work very well with people that don't really want to be in therapy. That's why I feel like every therapist, particularly if you're going to work with kids and teens, you have to know solution-focused and narrative therapy and postmodern therapies, because it's very helpful as a mode to go into and resort to when you have a client that is saying, I don't know a lot, or is not complying with treatment and that kind of thing. Anyway, so that is me talking about that. And I could go on. And I hope I've talked about this before in other episodes. If not, I'd have to add this to a list, because I have a whole module on collaborative therapies that's inspired by, my mentor, Bill. And, it's funny, Bill, being a mentor along these lines, he was also a mentor for me for psychodynamic therapy, but he also was a friend and an equal. And maybe that's the genius of his mentorship, is that he never made me feel like I was below him, maybe partly motivated by his very felt sense of postmodernism, or what we call postmodernism, but in therapy, but is more accurately called a collaborative sense of being in the world, that you are not here to impart, but you're here to highlight people's strengths. That's another phrase that people use with these kinds of therapies is strength-based therapy. You are not pointing out negatives. You're pointing out positives. You're saying, oh my God, you're telling me that last week when you and your husband had that good moment, that you chose to see it that way. That's a huge strength. I mean, you've been through a lot of shit with your husband, and there's been a lot of years of distance and pain. And in spite of that, it looks like you chose to look on the bright side. You chose to give him the benefit of the doubt. You chose to highlight something that was happening that was positive. That's a huge strength. Other people wouldn't have done that. Okay. So that is all real and and it has to be genuine. You can't be doing it as an intervention or as a manipulation. You have to believe it in your heart for it to come out right. And also, it's just a wonderful way to think about the world. It's so different. Now, where you can go too far with these, and I'll get this from my cognitive or my postmodern purist colleagues, is that you can't diagnose, because that's problem thinking. And you can't even conceptualize, because that's arrogant. So it denies a lot of helpful tools and ways of thinking about people and how to help people, So that's why, although I love this stuff, I am not a purist. Anyway, all righty. Well, that does it for that episode. Happy Friday, everybody. And until next time, please, well, maybe you could use this yourself. Think about your own strengths and think about the strengths around you. Maybe that's something you can do today, is think about strengths. One of the exercises that I do with my students is I will ask them when they're presenting on a case to give me a bunch of strengths. I don't say a number limit. I just say, just give me, a good list of the strengths that you see in that client. And for most students in the beginning, they have a really hard time coming up with it, because it might literally be the first time they've ever been asked that question, and they don't even have the language because they haven't had a model to them. And they will feel very bad about themselves when they come to me and they say, I'm having a hard time coming up with a list, and I feel like that's a bad thing. And what I'll say is, it's a normal thing, but it is a bad thing. And it's not your fault because you haven't been taught. So it's a matter of language and a matter of having a repertoire of language, but it's also a matter of mindset. In our culture, we don't think this way. When we see a politician or a public figure who does something bad or has a problem, we don't think about strengths. We think about deficits. We think about bad things. We think about problems. We think about pathology. And I am up for that because there's a time for that, but there's also a time for strengths. And if we clinicians can't rattle off the top of our head, that's the other thing that I train my students to do, is I don't want you to have to sit down and rack your brain for strengths about your clients. I need you to be able to rattle them off the top of your head because they're in the front of your mind, because you see the whole them. You see them for all of their glory. They're probably mostly comprised of strengths. And to ignore that is to ignore reality. I don't know what you do with that knowledge, but you need to see the whole person and you need to be able to see strengths. And once you see the strengths, it does help greatly because you can highlight them. You can also even just capitalize on them without even pointing them out. Like if you have a client that, like say this client that I was saying, where I'm saying, well, what a strength that you were able to put aside your pain and see the good in your husband. Let's say that, in another session, maybe in a couple session, let's say that this is a couple client and I'm seeing husband and wife, and there's a moment that I notice where she, in session, in the moment, is seeing the positive. Like she gives him the benefit of the doubt or something. And again, I'm not doing this as an intervention in the way that I'm not trying to manipulate her. I'm just highlighting something. I'm highlighting a strength. And so I would potentially say to her, oh, I think I just saw you do that thing that you're so good at. Correct me if I'm wrong, but did you just look on the bright side? Did you just give him the benefit of the doubt? Did you just put aside your pain and open up to him? Did I just see that right now? I don't want to put words in your mouth, but is that what, you tell me. And she would say, yeah, I guess I kind of did. And I would say, wow, that is a huge strength of yours. You've done that before. And what a wonderful thing that you do. I'm sure. And then I would ask in a very postmodern way, the way that they use postmodern. I have a hard time using with that phrase because it is so fraught and complicated. But anyway, a very postmodern-y thing to do is for me not even to know if that's a good thing. So I would say, I think that's a good thing, but I don't know shit. Is that a good thing that you are looking on the bright side? You tell me, but I don't know. Maybe it's a bad thing. Maybe it's a neutral thing. Does that help, do you think? Or is that not helpful? I do this all the time with clients, even clients that are compliant, because it puts the client in the driver's seat. I think it's helpful to look on the bright side, but what if it's not helpful? Plus, if I assume it's helpful, it sounds like I'm trying to tell the client what to do. And if they're not doing it, then by implication, I'm saying they're being irresponsible or a bad client because they're not looking on the bright side. Instead, if I were to say, I'm just noticing something, do you think that's a strength of yours? Do you think that helps? And they're like, I think that would help if I did think more positively about him and I was more open and it would help if I did put my contempt aside. I think so. Then I would say, okay, if that's what you say, then I will take your word for it and let's add that to the list. And so clients don't walk out of sessions feeling like they're being told something. They walk out of a session feeling like they accomplished something themselves. You know what I mean? And sprinkling a lot of this in can be very effective. Anyway, so I think that answers, hopefully, your question, good old Jocelyn. You asked the most amazing questions, Jocelyn G, and you also email in a lot of questions, which I really enjoy. Plus, Stacy, I think, knows to put your questions in my, towards the top of my list because you're a frequent person that emails in. There's certain others like Natasha from California, and, there's a few others that I recognize. Back in the day, it would have been famous patron Lyndon, these folks. And I like that because it helps me to feel like you emailers are real human beings. Because if every email is from a different person, then I lose contact. You know what I mean? It feels so much better because I always just bring it back to what it's like to be being a professor. I didn't teach thousands of students in a class. I taught 5 to 15 students, and by mid-quarter, I knew all the students pretty well, and by the end of the quarter, I knew them often very well. So it feels safer, it feels better, it feels like I have a consistency with people, and there's a through line of learning and experiencing. And so, Jocelyn, I appreciate you. And everyone out there, please take care of yourself, see the strengths in yourself and others, become habitual with that, and take care of yourself because you deserve it. You really, really do. Okay, actually, I don't want to end the podcast just yet because I just received an email from Haley Rose, who makes the out of context videos on YouTube, if you're familiar. And I emailed her back and said, is it okay if I use your name? And she said, yeah. So I wanted to enter her email because I don't know when I'll be able to get a chance to do it later. And I want to answer her email out of thanks for making those extremely hilarious out of context videos. Just go to Haley Rose on YouTube or look at my posts if you're curious, if you haven't seen them. There's a tab on our channel that is, I think it's the community tab. I'm not sure. And you could see all the, it's just like a feed anyway. So reading her email, she says, Dr. Anna, I have a question for the podcast. I keep hearing about how universities are all liberal and pushing left-leaning ideals onto students, but that has not been my experience. I am curious about your thoughts about this since you've been a professor. I've heard people mention things like, I had to learn about racism or LGBTQ topics in my art history class. They will use this as an example of liberal ideology being pushed on them. To me, discussing the influence that these experiences have had on art is not ideology, it's just fact. Even in my first semester of my social work grad program, which arguably is an understandable program that may be more left-leaning, the professor had us line up in a row to visually showcase the varying political beliefs of the class. Am I biased here, or are my frustrations valid? It just seems like there's a huge difference between learning about events and topics and being brainwashed. Would love to hear your thoughts on this. Haley Rose. End of email. Yeah. Well, boy, I would have to talk for months to fully express my thoughts on this because it involves so many things. As a professor, I have a lot of experiences and thoughts and ideas and things to highlight as strengths and things to highlight as weaknesses in myself and my program and other programs that I hear about and see and experienced as a student. And so there are just so many things popping off in my head. But in brief, what I will say is that, yeah, when you, like in art history class or in any history class, traditionally, brown and black people and women were excluded from history. You just had white men being highlighted as the only people that existed in history or the only people that mattered, right? And so to include women and black and brown people and others in the story of history, art history or just general history, is important because it's, one, accurate to do so because, I mean, it's for women, generally half humans are women. And so what about how they played a part in history or where are they in history? You know what I mean? We need to include that. And so, doing that is important. Like in art history, I could see how a teacher would highlight that art history in the United States tends to only talk about European art history, but that is just European art history. Why would we only talk about and why would we only talk about other groups of people and their art history as a chapter at the end of the course. Why isn't it, if we're talking about art history of the world, or at least art history as it pertains to Americans, why aren't we talking about all Americans? Because white people are only half of the United States, and a lot of white people are not from Western Europe, which is what, it's not even European art history. It's Western European art, or Northwestern art history, So to include Chinese art history and Japanese and Indian and art from Egypt. There's a lot of art history of Egypt, So, and to talk about how certain groups of people were excluded from discussions of art history, and that textbooks might not actually represent that. Is that pushing an agenda? No, it's being accurate, right? Like, I took history classes of various forms, and one of the things that was often highlighted in my the professors had the wisdom to say, look, we're going to talk about history, but we're going to talk about the real history of the United States. We're not going to talk about what is typically taught, but we're going to talk about like with Howard Zinn, and there's another book by a Japanese American guy, Takaki, I think. Anyway, it totally blew my mind wide open when I started reading these books in my mid-20s. I was like, oh my God, like, it's when I first discovered that Christopher Columbus was essentially the direct opposite of the way I was taught. I've been lied to. He was a horrific human being. I mean, Christopher Columbus is just another version of like Hitler, or worse, honestly. Like, the atrocities, and most people understand this, and yet to this day we have fucking Columbus Day, and we have the District of Columbia, and we have the Columbia River, and we have Columbus, Ohio. Like, no. That is not okay. So, it's a problem. Anyway, and especially like the Columbia River. I mean, anyway, I won't get it. So to talk about these things is to acknowledge reality. Now, if this is all you talk about, and in an art history class, it's like 9 chapters about racism and 1 chapter about art history, then yeah, that would be a problem. That would be going too far, or maybe pushing an agenda or something. I don't know. But more often than not, what's happening is that you have a class that is adjusting in a wise and balanced way, in a way that is not doing so to recognize racism, but is doing so to accurately represent the topic, right? If you're going to accurately represent art history, because art history comes from culture, and because culture is racist, you have to talk about racism. It's also sexist. It's also ableist. It's also classist. It's also a lot of things, And so you have to mention those things at the very least, and maybe go into detail on it, LGBTQ topics as well, about how, with art history and how that plays a role, And so it's accurate to do so. As you say, Haley, it's facts. It's just facts. And then you have a bunch of people in the United States who have been propagandized to and brainwashed to believe that any talk about racism or LGBTQ or classism or something is this liberal agenda that's trying to ruin America and turn us into a communist state. I literally had this conversation with a pretty good friend of mine, actually, that I didn't realize was right-leaning. And he and I were talking, and I'll have the conversation, and I was rolling with it, and there were things I could agree with and things that I would kindly disagree with. And then he basically said that the left is trying to turn America into a socialist and communist country. And I was like, what do you mean by those words? Communist? Maybe more socialist, depending on what you mean by that, meaning more taxes and more safety nets for people, and the government paying for more things, having more regulation, maybe even taking over certain industries, because when they, like with healthcare and with insurance and that kind of thing, depending on how you look at it. And certainly liberals and Democrats will have a lot of different points of view when it comes to even those topics, but to think that smart people that are close to me think that Democrats are trying to change this country into a communist country. I'm just like, so it's propaganda, they've been lied to. And even if we were trying to turn it into a communist country, communism isn't inherently bad. It turned out to be associated with some bad things, and we can debate it. There's forms of government and power and control and the ownership of property that we could talk about that are probably not conducive to today's societies and stuff, and maybe communism is one of those things. But any form of society or government can be horrible, can harm. You can have a form of government that's a Republican democracy, or a representative republic like we have in the United States, and that can be used to be horrific and imperialistic and racist and harmful and genocidal. And you can also have a version of it that is an overall good for society. It depends on a lot of things. So to just label like, ooh, communism, it's gonna, anyway, I'm not saying I want to become a communist. Anyway, point is that you have people that are, and this guy close to me is, he's not down the rabbit hole completely, and he lives in Seattle. And so he's not lost to liberals. He probably still holds, and I know that he does still hold a lot of views that I have. So think about all the people that are in other regions of the country who have been absolutely brainwashed by all these podcasts and YouTube channels and politicians and Twitter accounts. I mean, they're being cultivized in a lot of ways. Not all of them, but a lot of them have. And they have been told that to talk about these things is this ridiculous virtue signaling, agenda pushing, communist hoping agenda. And they probably are not even in college themselves. And so they're just hearing this secondhand, right? If they actually went to the class, they might be like, oh, this is nothing like what Joe Rogan was saying about this class. This is, there's a little, to them in their ears, they're like, there's a little bit too much talk about racism, but this is just a regular art history class, because that's usually the case. You know what I mean? Because when you reduce all of the university system in the United States to this one quality of pushing the liberal agenda as if it's a horrible thing, it's not a bad thing for any of us to recognize and talk about groups that are oppressed as it pertains to the topic. If you were teaching a class on how to cook, food, like a specific food, like how to cook pancakes, and you spent the whole time talking about civil rights in the 60s, then you would say, I signed up for a class on pancakes and I'm being taught about Martin Luther King and about Civil Rights Act and about Kennedy and Lyndon B. Johnson and and the sit-ins and all the, I'm trying to remember it's late, it's almost midnight. Anyway, that would be not as advertised. And the reason for that, there's various different possibilities. I guess one would be trying to push some agenda. Does that happen? No, that doesn't happen. If you actually take these classes, it's, because professors, they take their job seriously and they have a job to do, and they want to set you up to know the relevant information, which does include, discussions and the recognition of racism and homophobia and transphobia and sexism. It pertains. It's a part of the thing, because unfortunately our society is like this. So yeah, I don't even know if I like what I'm saying in this moment, because, like I said, in order for me to answer this question, I would have to talk for a very, very long time. And, but I feel like, so I guess I'm just agreeing with you, Haley. I'm just saying, yeah, agreed that people complaining about facts and relevant information being included in courses, maybe in a new way, meaning that they weren't included before. To say that that's pushing the liberal agenda is philosophically inaccurate. It is more accurate to say that they are just these classes are just now recognizing the reality of the topic at hand, right? Like, one of the things that I still see, more so outside of the city, but still inside the city, is that in a grocery store, there will be an aisle that will have, Asian food and Hispanic food and, food from, other, these areas, or associated with these areas, Asia. And the aisle will be called the ethnic aisle or the international aisle. And I think, what do you think, where do you think hot dogs came from? Where do you think pizza came from? Where do you think even bread came from? Do you think those sprung from the soil of within the American borders? No, they came ethnically from another ethnicity. They came from outside. So unless all the other aisles just have Native American foods, the entire grocery store is filled with ethnic food. Just call it Asian food, or non-white food, or non-European influenced food. You know what I mean? Just call it what it really is. It's not the ethnic aisle or the international aisle. And before people are like, well, it's like for immigrants and stuff. All y'all are immigrants. My Japanese ancestors have been here for over 120 years. So if you have Japanese American food in a grocery store, it should not be in the international aisle any more than pizza should be, or I don't know what else is in a grocery store. Or pancakes. I'm guessing they were not invented here, but maybe they were. Anyway, I'm yammering, but so my point is that, if I were to march on a grocery store and say, you got to change the name of that stupid ass aisle, just call it either non-white associated food, or just call it the Asian aisle, or the Asian / Indian / Hispanic aisle or something, at least that would be, to me, less stigmatizing and less otherizing than calling all the other food in the grocery store normal and my food international, meaning that it's not from here, even though all the food here is not from here. Anyway, so if I were to march and people were like, you're trying to push your liberal agenda, I would say, that's one way of looking at it. Another way of looking at it is I'm just trying to change the world to be more coherent and accurate and factual. It's not factual. It doesn't make sense. It's not coherent to call that the international aisle. Let me explain it to you, so yeah, like a better example is to have like fancy French cheeses and olives from Italy. They are not in the international aisle. They're in the cheese section, and there's an olive section. Those are not called international foods. They're not called ethnic foods. They're just called the cheeses. Or the wine section that has wine from Spain and from Australia and from France. You don't call that the ethnic wine aisle or the international wine section. You just call it the wine section, right? So why is Japanese American food, especially Japanese American food, like Spam, for God's sakes, will be in the international aisle? And it's like, one, Spam is fucking American. Two, Japanese people in Japan don't eat Spam. So, and we only fetishize Spam for the most part because you didn't give us food to eat other than army rations when you imprisoned us in World War II, and we made do by converting this disgusting meat mush into a delicacy and our soul food, which is Spam inspired shit like Spam musubi. So why is it in the international aisle? It should be in the goddamn normal aisle. You know what I mean? Can we be considered normal? Is it okay? And this is, and so am I pushing an agenda? Fuck yeah, I'm pushing an agenda. It's the right agenda. It's the just agenda. It's the accurate agenda. It's the fucking coherent agenda. And for an art history class to include topics of racism or to include black and brown art and art from women and art from poor people and art from oppressed groups of people, and to include topics and art from LGBTQ people is not pushing a fucking agenda. It's being accurate. And for white men Republicans who are going to complain, I have to say is fuck off, leave us alone, don't take our goddamn classes, go home. That's how I feel. But that's wrong to say, it's wrong to think, because it's not inviting and it's just causing the problems. But sometimes I don't give a shit. I just have to say this, and this is at the end of the episode that no one's listening to anyway. So I'm just going to have a meltdown right now and cry and go to bed. Sorry. No, I don't recommend that we do this. I think we should, honestly, I think we shouldn't be attacking anyone, at the very least, not stoop to their level, and at best, try to bridge the gap. Assume the best of people. People are good. White male Republicans are good people. They are. I believe that in my heart. I know that they're good, redeemable, wonderful people that agree on a lot of things with all of us. And I welcome you with open arms. And please just open your mind and don't listen to the propaganda bullshit anymore for just a month. Anyway, I'm losing my shit. Every day it's up and down, and you just experienced a down moment. But now I'm on the upswing, and I'm going to take care of myself, and you take care of yourself for a second time, because you deserve it. You still do.